There was concern that there's a major shortage of organs. 17 patients are dying every day awaiting a life-saving organ transplant. And despite that major shortage of organs, we are still at a discard rate of at least 10%. So our research was initiated to try to reduce the ischemia reperfusion injury in these marginal donor livers. And one of the major concerns that we had when we started our research was that there is no human platform available for testing.
If you look at traditional approaches, drugs are tested on cell cultures or organoids, they go to animal studies, and then from there you take the leap of faith to go into clinical trials. But here we have a system where we get human liver, we get human blood. These are discarded livers, which then one lobe acts as an internal control for the other lobe. So you can do testing of drugs and therapeutics comparing one lobe against the other. In terms of science, we do hourly liver biopsies on these livers. So it's really a robust platform for testing.
Our main concern is that we could not compare two livers coming from two different deceased donors with completely different operative circumstances and completely different risk factors in the donor. So we've created a platform where we can take these livers and split them into anatomically a right lobe and a left lobe. And then we have two normothermic perfusion pumps perfusing these two livers in an ex vivo fashion simultaneously, but with completely separate circulations. We tried to randomize the treated livers versus the controlled livers. We think that we can test agents that can treat liver diseases, including NASH and other diseases that can truly help adults and pediatric population suffering from liver disease.
Well, our next steps are really endless. So we think that we could expand this to other organ systems. We are already doing that for some. We can also look at organ rehabilitation in the future, which we think is really going to help decrease the wait time on the transplant list. We know that patients unfortunately die waiting for a liver transplant. I'm a pediatric hepatologist. It's particularly disheartening when you have small babies die waiting on a liver transplant list. We think with this methodology, we would be able to, one, help decrease the mortality on the wait list because we will have livers which we could rehabilitate, which may have been discarded earlier. And secondly, we may also be able to develop new drugs which could be given to donors, which potentially will allow those livers to be transplanted into babies.